Did you hear that there's a nursing shortage? Well, nurses aren't lying. They actually want out of traditional healthcare in 2026. What was once a profession based on clinical judgment, continuity of care, and professional autonomy has increasingly become a metric-driven enterprise. The focus is on throughput, cost containment, and standardization. This is stepping all over the professional nurse. And now nurses are speaking out and looking for a new way to practice professionally. That's why I put together the original video classes called RN to Business Owner. It has 28 video lessons, written documents, and multiple AI prompts to help you customize an independent practice. For the past 7 years, I've been teaching nurses how to identify a signature service and implement a private nursing practice the moment you need it. There's a link below, and I hope that you'll find it helpful and reassuring for your future in healthcare. Hey, nurse entrepreneurs. I want to start us out with a couple of psych questions. How many times in your healthcare career has the system made you feel exposed, controlled, exhausted, and sometimes even targeted? Did that same system make you question your strength and your sanity? Did it alter your mood or who you want to be at home? You likely know that all nurses feel these kind of feelings from time to time because life happens. Circumstances dictate how you feel about your job. But between a spiraling work environment and a sticky home situation, you can be left not knowing what to do. Regardless of your professional role or title, healthcare organizations, they just don't acknowledge your emotions or your coping capacity. But listen, they do want you a little unhinged. They actually need you dysregulated. I know it sounds crazy, but stick with me here. The healthcare system, whichever type of institution, they rely on profit and loss, billing and coding, and reimbursement, and those productivity metrics. That's a financial incentive. A revenue-driven service model isn't even partially designed for mental or emotional stability for the employees or the patients. They're in the business of making money. That's the foundation for every process within the system. And guess what? The inevitable happens. Staff cannot keep up with the expectations. I'm not telling you anything new. You already know. Nurses carry greater responsibilities. They have more legal exposure. They have less autonomy, less influence over decision-making, workflow design, or patient outcomes. For many nurses, and contrary to the popular narrative, the desire to leave traditional healthcare is not an emotional response, but rather a rational response to an emotionless business model. For institutions to satisfy their goals, your dysregulation is their process validation. They get to implement process improvement plans. They restructure standards of care that we've always known. They push the constant management turnover, changing the rules. The institution actually looks for the cracks to force those out that are falling behind. Every action serves their purpose. Now let's keep in mind, those business models, they're not designed for humanity or sensitivity. And working in those systems, we know your emotions can get really strong and destabilize your nervous system. And because of that, I talk to my soft exit entrepreneurs about not getting stuck in the lie that nurses don't have professional value outside of the institution. The clear and authentic message is that when nurses leave traditional healthcare, they're not abandoning their profession. They're repositioning their expertise into structures that allow for autonomy, integrity, and direct impact. But you have to acknowledge where the institution is actually coming from and whether that's where you want to be or not. They're not going to change. They will get rid of you before they change their platform. Now, when I talk about a clear and authentic message, we need to tune into what our bodies and our nervous systems are telling us. Nurses aren't lying when they say they feel exposed. Threat to safety is a real concern. Healthcare workers are 4 to 5 times more likely to experience workplace injury than other workers. We know that's unacceptable. Chronic threats to our safety keeps our body in a prolonged stress response, dysregulating the nervous system. It also impacts our hormonal and immune systems, which increases our risk for anxiety, cardiovascular disease, inflammation, burnout. Now, one of the biggest problems is when the healthcare institution controls the narrative and suppresses honest discussion. Nurses begin to doubt their own perceptions and internalize blame for systemic failures. Over time, this erodes our critical thinking skills. It does increase moral distress, and it trains us to self-censor rather than problem solve. Do you ever prioritize your assignment for the day so you do the least amount of harm? That's a sign you're internalizing systemic failure. Again, unacceptable. When your job is making you feel crazy or unstable, you're more apt to fall into the termination trap or a black eye to your professional reputation. Now, your nervous system is like a truth serum. It's only when you try to dupe yourself into believing that it's not really happening, or if they knew better, they would do better, that we listen to that wrong messaging. I do want you to know that it's okay to speak up and advocate, but even with controlled empowerment, it could backfire, leaving you in an unintended position. You absolutely can work for the institution, but be aware. The skills needed to survive in that environment aren't found among your nursing skills. There is constant conflict around this very subject by nurses speaking up. The broken healthcare system wants your dysregulated behavior. It rationalizes their stance on profit over truth. Let's not fall for it. Medical professionals have options. We can still care for patients, we can still speak the truth, and we can practice professionally with a consistent thread of integrity. Imagine that. If you're someone that has to rely on the institution for income or a specialty skill, stay superficial. Don't get caught up in the unproductive drama. Choose to follow your own growth agendas. Remind yourself, I'm dealing with a money-making machine that doesn't have human characteristics like integrity. I'm hopeful that you can open up to a few new options for your professional license and skills, to use your skills that the institution just isn't designed to honor. At the very least, you can move forward with the self-validation that your nervous system is telling the truth. There's no need to let an emotionless business construct make you feel crazy. If you haven't already, please hit the subscribe button. I'm new here, and I'm happy to share my experience and insider knowledge. I know it's hard sometimes to listen to your own health and to make sense of what to do about it. I've put together classes to guide nurses through the planning and implementation phases of starting a business. We have lessons like mindset transition to shift to a scope-based business with integrity. We guide you through all the business basics and the in-between. A soft exit is about setting career goals for your professional license with a full path forward right when you need it. All right, nurses, you're not lying when you say this is too much or I can't take it anymore. You're dealing with a system that doesn't even consider you as a person. So I'm hoping that you can tap into your transferable power skills like emotional intelligence, boundary setting, situational awareness, and self-regulation under stress to flip the script that you're actually stuck in a broken system. And when they bring "it's our way or the highway" messaging, you'll be prepared with a soft exit plan that protects your future in healthcare.